So before we begin, I'd like to start by taking a poll of our audience using the Zoom hand-raising feature. Raise your hand if in the past 5 months you felt yourself cough or momentarily struggle to breathe and immediately panicked, convincing yourself you had COVID-19. Yes, as I expected, I see a lot of those hands raising. But today I'm happy to tell you all that the DetecTech device stops that panic. But first, I'd like to introduce to you my team.
Hi, my name is Talin Kalikian, and I'm the CEO of Corp13.
My name is Sarah Eldrin-Fritz, and I'm the Chief Human Resource Officer.
I'm Cameron, and I'm the Chief Operating Officer.
I'm Ellie, I'm the CIO.
I am Aidan Moore, and I am the CFO.
My name is Saraswati Bhatta, and I'm in Community Development.
My name is Yomari Mojica.
Hi, my name is Adriana Ortiz.
My name is Juana Salazar Lorenzo.
Hi, I'm Ethan Prado, and I'm in the Business and Finance Department.
My name is Kevin Zhu.
Hi, I'm Derek Tutt.
My name is Jasmine Rios.
I'm Maya Collier, and I'm in the Research and Development Department.
Hello, my name is Leilani Smith.
My name is Tim.
My name is Indiana Burrow.
My name is Dara. My name is Destiny Sloan, and I'm in the Marketing and Communications Department.
My name is Jackson Cecil.
And together, we are
chose to work with a problem statement from Purvis Systems to design a non-invasive wearable device that tracks symptoms and biomarkers of COVID-19 in the United States military. The 3 requested functions of the device were to detect physical symptoms, to detect antibodies, and test for any other biomarkers of COVID-19. The questions you see here on the screen helped us unpack the problem. Creating such a device is really important because COVID-19 specifically impacts our military since they were called into action against the pandemic, and they have to work and train in close quarters still.
Through our weeks of research and ideation, we decided to help Purvis in its mission by creating a chest band which sits underneath the wearer's sternum and has a corresponding analysis software. Our sensors come from pre-existing technology and companies, making it easy to produce. By tracking the user's health through various sensors, both user and administrator can receive guidance on when to carry out with care, isolation, and testing plans. This immediate feedback allows for tracking and prevention of the disease. And so now I would like to share a demonstration of our device system.
What makes our device unique is our focus on 2 core attributes, comfort and analysis. Early on in our design process, we spoke with Major General Callahan of the Rhode Island National Guard, who stressed the importance of keeping the design low profile. To avoid discomfort, damage, or interfering with other equipment, we kept our sensors small and embedded sensors into an e-textile or a fabric with integrated electronics. As you can see by our final survey, 85.7% of people said they would be comfortable wearing the device. We also wanted to ensure that people felt comfortable entrusting their sensitive health data to the device. So we met with Warren Powers, a cybersecurity expert from Citizens Bank, and decided to include the latest form of encryption, TLS1Q, and anonymized data. In terms of analysis, the device tracks a comprehensive list of symptoms, including low-grade symptoms that could often go undetected. We give the user an actionable result through an easy-to-understand risk level, complete with a guide to next steps. Finally, we give administrators access because we know the military personnel aren't always on their phones and we wanted to keep response times down. As you can see, our administrator dashboard got a really positive response.
As you can see in this top picture, our first iteration only had a green Cordura band, the white green tag core temperature sensor, and that black e-textile band. We didn't know how the clips or really the sensors would work. After going through our second iteration, we considered using plastic clips for connections, but we ended up using a soft Velcro hook and loop tape between fabric segments, now including an elastic section. We also arranged some sensors to avoid discomfort or mechanical failure. For our software, we only included our mobile app at first using a color-coded user interface, but later we included a full range of symptoms using that same interface. We also created an administrative dashboard and a more info page and information buttons for ease of use after receiving mentor feedback like we did for all of our design choices.
Our target market is the military, which currently employs 1.3 active duty personnel nationwide. Of that, 3,371 are in Rhode Island. From Major General Callahan, we learned that about 90% of Rhode Island's National Guard was on duty, and that 40 or so had contracted the virus in those early 2 months. Being so infectious, the disease readily bars the essential activities of the military, especially when done in close quarters. Even still, the military has been faced with new responsibilities during the pandemic, such as assisting in nursing homes, training the public on infectious diseases, and conducting testing.
To our surprise, there are a lot of people already working on a similar problem as us. We found that the existing devices fall under 3 main categories: the ring, the smartwatch, and the throat patch. Some detected symptoms coincidentally, while others, like the throat patch, are new inventions. From examining which symptoms our competitors tracked, we chose the chest band since its positioning allows us to track the greatest number of symptoms. For our target market, this design was helpful in terms of durability and not interfering with other equipment worn by the military. We further cater specifically to this military setting through the inclusion of our administrator dashboard.
In terms of rolling out our prototype into a physical device, we have identified 5 important steps. First, we will need to conduct more real-life research to ensure all of our parts work together properly, since we were not able to do so due to the format of this internship. Then we will need the help of military engineers to take our markup and turn them into fully functioning app and dashboards. Next, we will need to continue making connections with the companies we are sourcing materials from, locate a facility to produce the product, and lastly, expand our target market to other essential workers.
While we're extremely proud of the product we've created, we still have our sights set high on an even better one. One feature to do this would be to offer an optional over-the-shoulder strap for comfort and security, as well as for size and gender inclusivity. We would also like to further improve our software for ease of use based on the real-life user feedback that we get back. Third, we hope our future generations can include in-device mobile viral testing, because we discovered one researcher in the developing stages of such a device, so we're hopeful that such technologies can be included in the future. Lastly, we want to improve our cough detection system as more research arises, especially since our device is really flexible with how the disease develops. Now, I know many of you said in the beginning that you relate to that panic of potentially having COVID-19 from just those small symptoms. But now I'd like you to put yourself in a potential DetecTech device military user's shoes. Comfortable sensors connected, mobile app in use, and knowing your administrators have your back. And just think, would you still feel that panic? Thank you.